This new study from the team today shows the firm's diagnostic orchestrator, which uses OpenAI technology, can correctly diagnose up to 85% of case proceedings in the New England Journal of Medicine. This is a rate more than 4 times higher than a group of experienced physicians, and it's more cost effective, according to.
No, you definitely still need your physician. Your physician is going to be there to make the right judgment call at the right time, to plan the treatment that often comes right after the diagnosis, and essentially to oversee and organize and hold the AI itself accountable. Essentially, what these models are doing is that they're looking at the vast array of existing medical information, synthesizing it, and presenting it back to the human at the right time. This is an amazing interactive experience. AIs are now actually asking questions of the data themselves, recommending what tests to get, and then iteratively, sequentially improving the accuracy of its diagnosis as it learns more information. And so doing that in partnership with physicians, themselves is clearly going to be the way that this gets rolled out, I think.
How are physicians getting trained in AI?
Well, I mean, today, you have to pass the US MLE, the medical licensing exam, and you need to get about 60% on multiple choice questions. These models get upwards of 95% accuracy on those questions. But the really unique thing about this model is it doesn't just use one AI, it actually uses all 4 of the big major AI developers and essentially goes to whichever one is most accurate at any given time. And that's what the function of an orchestrator is. It decides when to use a big model or a small model, or when to use lots of thinking time or a little. And it is able to kind of get a much more accurate answer by taking the best of all possible models.
In many cases, healthcare decisions deal with life or death, Mustafa. How do you build trust in this technology?
Well, the cool thing about this method is that you can actually see why the AI is coming to a particular conclusion. And as you add more data, it updates its best estimate of what the diagnosis is likely to be. And so that gives a lot of transparency around how it's thinking, what data it factored in, which tests it does. So this is actually an unprecedented amount of transparency, which of course is key to trust, because you can actually go back and look at the entire conversation that took place between many different agents that are all coordinating with one another to debate on what the most likely diagnosis is going to be. And that, I think, ultimately is the best way to improve trust.